There are many causes of sudden death in ewes and lambs. Two common causes are due to Clostridial and Pasteurella disease. Clostridial bacteria are found in the soil, and as well as that in the gastrointestinal tract of normal healthy animals. The result of Clostridial infections results in sudden death of animals. Clostridial bacteria are often ingested or can actually infect the animal through a contaminated wound. And when there's a change in the environment, such as tail docking or introducing concentrate feed into the diet, that can change the pH down in the stomach. That can lead to the bacteria growing and releasing their toxins. The Clostridial toxins are the most lethal toxins known to man, and they result in sudden death of that animal. Similarly, Pastorella bacteria are found in the respiratory tract of normal healthy animals. When those animals become stressed, such as a change in the weather, a change in the environment or weaning, that can lead to the immune system becoming weakened. And it allows the Pastorella bacteria to grow and multiply and lead to conditions such as septicemia and respiratory disease and pneumonia. And again, the Pastorella bacteria can release toxins that result in sudden death. One of the most common causes of sudden death in lambs is pulpy kidney. However, ewes are susceptible to Clostridial infection the whole way through their life. Unfortunately, because we find a lot of these animals either dead or dying, the chances of getting in to treat is low. And even when we do give treatments, the response to treatment can be poor. Heptivac P really does play a key role in minimising losses due to sudden death. So what's your approach then to reducing the impact of sudden death in your flock, Richard?
Yeah, we vaccinate our ewe lambs 2 shots 4 weeks apart, and then we give a booster shot to the entire flock before lambing.
That's really good then, Richard, that you're vaccinating pre-lambing, so that'll boost the amount of antibodies in colostrum. So then once the lambs are born, they'll receive that colostrum and gain the benefit of those antibodies for the first few weeks of life to protect them. Kieran, if a farmer has an animal that dies of sudden death, do you advise taking that lamb to the lab?
Yes, we would recommend that any sudden death is taken to your local regional veterinary laboratory. It's a great service that maybe isn't as well utilised as it should be. If geographically you're not very close to a lab, speak to your vet, and your vet will probably be able to take some samples from that animal that's passed away and send those samples away to the lab and find out maybe the reason that animal has died. So every animal that dies is a cost on a farm, so you need to establish the reason that animal has died and so prevent future losses. So it is very important to get those animals into the lab.
And it's important as well, Kieran, to act on that report and speak to your vet in a timely fashion to reduce any further losses.
It really is. So your vet will phone you with the report when they get it back, and based on that then you'll come up with a plan. For Clostridial disease, it's really important that you start vaccinating stock from a young age, that all animals receive the primary course of the 2 initial shots, and from there they get an annual booster thereafter. So many diseases are covered by that Clostridial vaccine. It's important and it's economically beneficial that most farmers will carry it out, particularly where it's been shown that there's Clostridial disease on the farm or you've lost animals to Clostridial disease before.
That's great. So the key message is take those animals to the lab and speak to your vet about the results.
That's
to
it.
put in a control programme.
That's it.